Hello, my name is Jayme Gates, and I am a student at the West Coast University Orange County campus. I am enrolled in the BSN program and about to start my mental health clinicals. Let me start by telling you a little bit about myself and why I'm interested in applying for the Oxford Honors program. I am 30 years old, and for the last 12 years, I have worked in the medical field. I have worked as a medical assistant and then as a phlebotomist. As a phlebotomist, I came to know many of my patients and their life stories during some of their darkest times. Even in a few short minutes of our weekly visits, I was able to provide support and comfort to my patients. It wasn't much, but to them, it made a difference. This is where I found my passion, caring for people. And about 2 years ago, I decided to go back to school to pursue my dream of becoming a nurse, to fulfill that passion. After earning my associate's degree, I applied to West Coast University, and it has been the best decision I have made thus far.
Today, the government announced the number of deaths from antibiotic-resistant diseases has reached 10 million. Spread of antibiotic-resistant diseases means we can't treat even the simplest infection. The Department of Health is warning everyone, wear a face mask, don't spread antibiotic-resistant diseases. Let's cut to Dr. Schmidt in Canberra.
We told everyone 40 years ago that this is how it would end. People abused antibiotics. They took them even for a cold, when antibiotics can't cure colds. They ignored medical advice. You can't save yourself. It's all too late.
If only we could turn back time.
The global health topic I chose was antimicrobial resistance. While working in the medical field, I have seen many people stricken by disease and death. And it's amazing how far technology and medicine have come. They have paved the way for innovative thinking and creation of antimicrobials to help us control, fight, and treat these extremely versatile bacterial infectious diseases. However, this relies mainly on compliance. And unfortunately, their wide variety use and non-compliance makes these bacterial pathogens become resistant. This is also true for antimicrobial resistant bacterial pathogens in animals, which affects public health when transmitted to humans as foodborne contaminants. Now, day one in nursing school, we're taught patient safety over and over again. That's our motto. If we are not using the correct antibiotics, then we are jeopardizing our patient safety. It is our duty to be aware of the pros and the cons of antibiotics, and to be educated and to be able to educate our patients as well. Antibiotics are miracle workers. They're made to treat, to cure. However, each time we use them, our bacteria becomes weak and mutates into new strains of itself to survive. And this survival mechanism can have a certain negative impact on public health in general. The chair for the ICPIC, Professor Didier, Pittet, states, antibiotic resistance should come to the world global agenda. We're not only as doctors invested, but patients are invested. Trade systems are invested. So are industries, economy, human rights, food. It really is becoming a global issue. This is important because the more resistant these antimicrobials become, the more generalized they will be. One example of this resistance can be found in India, where studies have shown antibiotics are already becoming more and more ineffective. It's important to understand this and stop this trend, not only in developing countries, but here at home as well. Antibiotics are the tools, and just like any other tool, if misused, they can cause harm. It is important to recognize this issue affects everyone and is one of the most urgent priorities internationally in the fields of public health today. I'd like to thank West Coast University for inviting me to apply to be a part of the Oxford Honors program. I truly am honored. And if selected, I know this opportunity will not only be a tremendous asset for my nursing career, but also an experience for personal growth and knowledge. Thank you.